Hello, I'm Brian Haug, President of the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. Drug costs, biosimilars, and technology took center stage at the AMCP Managed Care and Specialty Pharmacy Annual Meeting, which took place in San Francisco last week. Our top 5 takeaways from the meeting. Biosimilars are generating excitement. Cost remains top of mind. Patient demands are driving digital solutions. More breakthrough therapies and orphan drugs are expected, and the opioid epidemic is real. During the meeting, AJMC spoke with Dr. Kelly Clark, President-elect of the American Society of Addiction Medicine, about the scope of the opioid epidemic.
The scope of the addiction problem is epidemic. The Center for Disease Control has called prescription drug abuse an epidemic, and they don't use that term lightly. More Americans die from unintentional overdose than die from motor vehicle accidents. We found now that the abuse of opioids, unintentional overdose deaths, have actually decreased the anticipated lifespan of a segment of Americans, particularly middle-aged white women. The scope of this problem is enormous. We have about 2 people in this country die every hour from opioid overdose.
For full coverage of the AMCP meeting, visit ajmc.com. A case heard before the U.S. Supreme Court this week could have fallout for drug makers and consumers. The case concerns new rules for reviewing drug patents, which the drug industry is challenging. A lower court ruled in favor of the Obama administration, and the 4 liberal justices, along with Justice Anthony Kennedy, sounded skeptical about the industry's position during oral arguments Monday. With the vacancy on the court due to the death of Justice Antonin Scalia, a tie would uphold the lower court, leaving the administration's rules intact. This week, CMS finalized a long-awaited rule for Medicaid managed care and the Children's Health Insurance Program. It's the first time these rules have been updated in more than a decade, and the changes reflect the explosive growth in Medicaid that has come with the Affordable Care Act. The final rule will allow for the first ever public rating system of healthcare quality in Medicaid managed care, greater use of electronic notices for consumers, and more alignment between Medicare Advantage and the Medicaid programs on the federal marketplaces. The most controversial element is a medical loss ratio of 85%, which critics say will disrupt successful programs in some states. Today, 2/3 of the 72 million Americans in Medicaid are enrolled in a private managed care plan, according to CMS Administrator Andy Slavitt. He said the new rule will allow states to continue transforming the delivery of care. Slavitt wrote this week, "States are making gains in using population-based payments, episodes of care, and quality-based payments. In addition, states operate 30 home health programs that focus on coordinating care for people with chronic conditions like obesity, diabetes, and mental health conditions." Finally, research published this week in the American Journal of Managed Care shows the value of care coordination in a key group at risk for hospitalization: children in Medicaid who have type 1 diabetes. Researchers used electronic health records from a group of children's hospitals to analyze whether being in traditional Medicaid or managed care had an effect on 90-day readmission after a child with type 1 disease was admitted to the hospital, including those admitted for diabetes ketoacidosis, a common and very costly condition in this population. They found that those in managed care were less likely to be readmitted overall, and the amount saved across 42 hospitals over a 3-year period was $2.6 million. To read the full study, visit ajmc.com. For all of us at Managed Markets News Network, I'm Brian Haug. Thanks for joining us.